You know, the world of psychiatric classification can feel like a total maze. But what if I told you there's a simple key, one single idea that unlocks the fundamental difference between major mental health conditions? Well, in this explainer, we're going to give you that key. We'll show you how it divides the entire landscape of the mind into two very distinct worlds.
So let's just jump right in. What is that core principle? What's the fundamental difference that sorts all these complex disorders into two separate, understandable worlds? The answer boils down to two words you've probably heard before: psychosis and neurosis. Now, of course, the reality of a diagnosis is always more nuanced than this, but at a high level, pretty much all psychiatric disorders can fall into one of these two buckets. Getting these two terms down is the first step to seeing the whole picture.
So, what really separates psychosis from neurosis? It's not about how severe a condition is, or even about the specific symptoms. Nope. It all comes down to a single, powerful concept: insight.
It might sound almost too simple, but this one concept is truly the key that unlocks the whole system. Once you really get it, everything else just kind of falls into place.
And here it is: insight. In the world of psychiatry, insight just means one thing: a person's awareness of their own illness. That's it. Do they know they're sick? This simple yes or no question is the fundamental dividing line.
And here's where it all clicks. With psychosis, insight is absent, gone. The person genuinely does not believe they are ill. But with neurosis, insight is present. The person is fully aware that something is wrong, even if they feel like they can't control it.
Okay, so let's take a closer look at that first world, psychosis. What does it actually mean to experience the world without any insight into your own condition?
This is one of the absolute biggest challenges in treating psychosis. I mean, think about it. If you don't believe you're sick, why in the world would you accept treatment? It wouldn't make any sense, right? This lack of insight can be a huge barrier to getting help, and it's often why family and doctors have to step in.
Some of the most well-known disorders in this category include schizophrenia, where a person's entire perception of reality can be altered. Then you have what are called affective disorders, like mania, very severe depression, and bipolar disorder. In each of these, the state a person is in can literally prevent them from recognizing that they're in the middle of an illness.
Now let's jump over to the other side of this divide: neurosis. This is a completely different world, because here, insight is present, and that changes, well, everything.
And neurosis, the experience is totally different. The person is aware they have a condition. They know that their thoughts or feelings are distressing or aren't, normal. And that awareness is often the very thing that motivates them to seek help in the first place.
The disorders in this category are probably pretty familiar to a lot of us: OCD, phobias, anxiety, bulimia, and PTSD. In all of these conditions, the person is typically very aware that their thoughts or behaviors are irrational or excessive, but they feel powerless to stop them. That internal conflict is really a hallmark of the neurotic experience.
Okay, so we've explored the two worlds of psychosis and neurosis. Now let's put it all together for one last crystal clear comparison.
Here's the whole thing in a nutshell. Psychosis is defined by an absence of insight and includes disorders like schizophrenia and bipolar. Neurosis is defined by the presence of insight, with disorders like OCD and PTSD. See? Simple as that.
If you remember just one thing from this whole explainer, let it be this: the primary dividing line in this classification system is the person's own awareness of their illness. It's a simple but incredibly powerful concept that helps make sense of the entire complex landscape of mental health.
So, how does knowing this distinction really change the way we approach mental health? How does knowing whether someone is aware of their condition affect how we communicate with them, how we treat them, and maybe most importantly, how we empathize with them? That's a question definitely worth thinking about.